Welcome, everybody, to the Live Your Raw Life podcast. I am so grateful today to be joined by Dr. Milien. Today's conversation is simply about prevention, partnership, and supporting the body before crisis occurs. Dr. Milien is a board certified physician in family and obesity medicine with over a decade of experience as a hospital and medical director who has seen firsthand what happens when prevention is overlooked. His work blends nutrition, lifestyle optimization, and evidence based care to support the body's innate healing capacity. Through his practice at Precision in Fishers, Indiana, he focuses on early intervention, objective data, and helping his patients not just survive, but thrive. Thank you so much for being here, Dr. Milien.
Absolutely. Thank you for having me.
It's truly my pleasure. So you began your career as an inpatient hospital at an inpatient hospital and transitioned into more proactive, data-driven primary care model. What was the turning point for you where you realized the traditional system just simply wasn't enough?
It wasn't just one thing that actually made me make this switch. It was multiple of them, in fact. Every day in the hospital, I'll see patients come in with preventable medical problem. Let's say heart attacks, strokes, diabetic complication. And I ask patients, did your doctor know that your blood sugar was high, for example, or that your kidney function wasn't at its best? And then they'll say, they never mentioned that, or they did mention it, but it kind of like we didn't follow through on that. And we'll talk about why that happened most of the time. So the traditional healthcare system is built to react. We all know that. So you get sick, then you go see your doctor, and your doctor writes you a prescription, and hopefully you get better. If you don't get better, then you go to the hospital and we take care of you. But I realized I didn't want to keep treating patient this way. Although what we do is really good, we're saving people's life, but we could do so much better. You know, the question was, what if I could actually prevent someone from becoming diabetic to begin with? Like if I could get you much earlier, and that could actually really make a difference. And I was thinking about this early on in my career. I would say probably 5, 6 years after I become a physician. And then the idea came up to kind of like, okay, well, the best preventive medicine is primary care. And how do we, and of course, our primary care system is not really good. So how do I make a system that works well for my clients so I can catch them earlier as compared to allowing them to get sick and react to it? So this is basically how we get here. This is why I build precision primary care around prevention, and data tracking, so we have time to partner with patients and get things done before they get sick.
Yes. Oh, it's so beautiful. And I love that. I love how you kind of took a hawk's eye vision view of the care system as a whole and was like, wait a minute, there's something we can do a little different. And so you made that switch. And when we had our conversation a few weeks ago, I just left that conversation so elated, like, yes, this is true health care.
Right.
And it's just amazing that you offer that for your clients and your patients there at Precision. One other thing that we talked about and that you expressed is the importance of that physiological data in helping patients engage in their own health. Why do you think that having that data is such a motivator for your patients?
As physicians, we see a client and we say, hey, your blood pressure is high, here's some medication, or we would say you need to lose weight. So the blood pressure is high, is it data? But a lot of time we don't show that to people. We just tell them the blood pressure is high.
Mm.
And and we tell them, hey, this is what you need to do. We give you a medication sometimes, and people, most of the time, people are good enough and they use it to improve their blood pressure. But sometimes we have people who actually, we call them non-compliant,
Mm,
and and they become non-compliant because they don't understand why they need to do what you're asking them to do. You know,
right.
so telling someone you should eat better, for example, or you should take blood pressure medication without showing them, or you should exercise without them seeing why, why this is the case, is has a really high risk of or fail level in it, basically. So what we do, um, but when you show it, when you actually show someone, for example, hey, your blood pressure is high. Every time you come to the clinic, your blood pressure is higher. Or, for example, that you overweight, but this is where the fat distribution is. So telling someone you're overweight and having your numbers saying that you're 200 pounds, for example, and your BMI is 30, that is fine. Telling them that is okay, but showing them that is a whole different story. Where people can see the fat distribution, where people can see the, for example, internal fat, like what we call visceral fat, that before that we could assume there is visceral fat, but now we can see there's visceral fat. The patient can actually see it themselves. You know, that makes such a big difference in their life. And then you can see people being much more proactive because we're talking about their numbers at this point, not some hypothetical numbers that we 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 spinning out basically. So for us, we thought, hey, if we're gonna do precision, and this is why we call ourselves precision, and mainly because it's data driven, because we want everything to be data driven. We want to be able to show you what's going on with your body, what's going on with you, and how we're going to help you improve that. And if it doesn't work, we'll find something else. But the data are there for everybody to actually go through and can go back and say, hey, this is where I was, this is where I am now. And that makes for better medicine in general.
Absolutely. When we see our numbers, when we see the results right in front of us, it's tangible. We can't ignore it. It's like looking in the mirror. And that's one thing, you are also a Mela Scan practitioner there at Precision, and you use that as a tool, which is such an incredible piece of technology that can shift the dynamic between you and the physician and the patient, because it then becomes a collaborative experience where you two get to work together. And I think that that is so important. And just like you said, is being able to see where the fat distribution is, being able to see your blood pressure, being able to even see maybe there is something going on with blood sugar levels and we need to dive into that. And so, how do you see the Mela Scan technology supporting, not replacing necessarily your professional insight, but supporting that in the work you do for patient self awareness?
Well, the Mela scan's been huge for us. We actually built a clinic around the Mela scan, which is crazy because most people don't even know what a Mela scan is. And I think in Indiana, we are the only provider with a Mela scan.
Yes, you are.
So it's a it's huge for us that we're doing something completely different. Now, when I said I wanted to do medicine differently, and I came across the Mela scan, and I couldn't be any happier because then I'm like, yep, this is exactly what I wanted. So let's put it this way: it's almost like having a financial advisor that can say, hey, you're gonna lose money in 6 months, and then you can pull your money out of the market or do something different. It's almost like having, a crystal ball where you can see things happening before they even happen. And that's what the Menlas can do for us. So what I like about it is the fact that we use it for things that's happening right now with the body that we haven't actually even felt yet. So that's what the analogy about the pulling your money 6 months in advance, because you have inflammation in your body, you haven't felt it yet, but the Melaskin can tell you, hey, this start brewing. You have cardiovascular issues that you haven't actually start feeling symptom yet, but the Mela scan can actually start detecting some of those things. Your vascular irregularities can be seen. Your I would say your whole 11 organ system can be accessed by the Mela scan, where we get information that can help us make decision for our patient. And again, because we're data driven, those things are there for the patients to see themselves. So it's not just us assuming, and they write there for them to see. What we bring to the table is being able to explain the science behind, or the pathophysiology behind what's happening to the body. And people, everyone who does this have been ecstatic in our clinic. But we use it for training patients. We use it for every single first time patient, and we continue to train those patients if we're working on something that needs to be monitored. And those patients is part of our packages for everything that we do in the clinic.
Yes, and to have the ability to track over time, like you were
Right.
saying, you put that money, if you do put that money in, and then 6 months, you see the benefits of that, you're like, oh my goodness. And then it just can be so exciting for people to continue down that trajectory. Like, okay,
Right.
doc, what's next?
Right. Exactly.
Yes, exactly. It's so incredible. So it sounds like, yes, you are the only Mela scan practitioner in Indiana currently. And you're right, it is, this new technology, although it's been around for almost 30 years, different iterations. And so educating on people on the system can be a process in and of itself, but once they step on the system and see in real time what their body is telling them, it's like, where has this been my whole life?
Right. Right.
And that makes me very excited for you and your practice, and something that we'll get into later on in our podcast today, of something that you have coming here new in the new year. But with all of that, how can, when we're looking at our results, how can we understand something like hydration and mineral balance to help us prevent injury or burnout or some of these long-term health issues? Like when we see our numbers, because everything's colored, numbered, and scored on the system, when we see that, how can we then start incorporating different modalities or action steps where we can really support ourselves with not letting things get too out of control?
Yeah, no, absolutely. With the help of the Mela scan, we're able to detect a lot more imbalance, especially electrolyte imbalance in the body. And I would say at least 50 to 60% of my patient population do fall on that. And you know, I would say hydration and mineral balance is a massive and underrated thing that we as physicians, as healthcare practitioners, we don't discuss enough, because we don't measure it, we don't test it very often. We do that by lab tests, but the lab tests are not always abnormal enough for us to actually take any decision in that matter. So this is huge for athletes, for people training hard. If you dehydrate and you depleted, you know, have low magnesium, potassium, sodium, or any electrolyte, your body can't function optimally. So your muscle, is not, you're not having the same power on your muscles as you used to. You have all those people that will complain of muscle cramp, they recover very slowly, their performance will drop. And with that, then risk for injury goes up. And so I know I'm talking about more of athletes here, but that happens to everyone, every single person. It's not just athletes, you know, but in or even we're talking about regular people, chronic dehydration leads to cognitive impairment. Like, your mood get, changed a little bit, and not to count long-term issues on the organs like your heart and your kidneys, that leads to. So the problem also that we see is most people think they're hydrated. People go around with the Stanley cup now, they're drinking water, and I think that's great. And I'm not saying no, but drinking water is not the only thing that hydrates you. You need electrolytes, and not having um, a way to measure those things appropriately will leave you to basically operating in the dark. So this is why we we pairing our Mela Scan with IV therapy in our clinic. So because I do inpatient medicine or acute medicine, care medicine, I am very comfortable with IV hydration. I'm very comfortable with giving people hydration, and we know that the best way to actually replenish yourself is to actually get it straight up to your veins, so you're not missing too much. Like if I take a Gatorade, my stomach has to process it, get as much as in it, and then get the rest out. So you could say when I actually get IV hydration directly to my blood stream, it does the job that it's supposed to do instantly. And this is what we do at the hospital anyway when people get very, very sick. My question is, why aren't we doing it to prevent people from getting sick, too sick? So using the Mela scan, to tell me what's going on, and having the system where I can actually fix that problem in real time to prevent people from getting sick, make us really phenomenal.
Absolutely. It makes all the difference. And like you were saying, yes, you can go ahead and drink a Gatorade, but if there's something that's out of balance in your digestive system and you're not absorbing the minerals like you need to, that's going to wreak havoc, because then you're still kind of climbing this uphill battle, so to speak, rather than if you take in an IV, it's going directly to the bloodstream. So you're getting it right where it needs to go.
Right, absolutely. And for you've seen that with athletes, and they do this all the time. The question is, and I'm talking about like pro athletes. The question is, why aren't us, the regular people, doing it? It's because we're not talking about it.
Mm.
No one mentions that. No one will say that, hey, you know what, you could improve your kidney function by actually get IV fluid, which is what we do in the hospital when you're sick. We don't have to actually wait for you to get admitted to do this. We can do it in the outpatient, where you're not losing time, you're not losing money, you're not losing health, basically, because every time you get so sick, you go down a notch and you never go back to the same way that you were unless you actually have the support to heal yourself a lot better, which most of the time we don't.
Exactly. The body is so brilliant. It knows exactly what to do when given the correct information.
Yes, yes, and then that's part of our philosophy here. Is the body can heal itself. We just need to support it appropriately, and you know, and that's what we do. We do at Precision.
Oh, it's so beautiful, man. It's such a shift when we start looking at healthcare and we start taking this holistic, this big picture approach. And I believe that you're in such a beautiful position, Dr. Milien, because you're able to educate your patients and your clients on their own body's innate wisdom. That I was a health teacher in public schools for 15 years,
Right,
and I know how much knowledge we get about our own bodies in that. And it's just a little teeny tiny
right,
bit.
right.
And
Very
so,
little.
yeah, exactly. And so you as a professional, you also kind of have this road ahead of you where it's a blessing, and also maybe sometimes like, okay, if we could do better at the start and introduce the wisdom that we know about our bodies earlier on, then it makes your job as a doctor so much easier, because they already have a foundation. But because that's not always there for people, you have this gift to be able to share with them, like, this is your body's innate ability. Let's work with it and then expand the options and the horizons from there to better their vitality, their regeneration of their cells. I mean, down to, that mitochondrial level. It's so incredible.
Right. No, you're completely right. Because again, there's one thing we don't in line of what you're talking about, which when you talk about like catch them early, start teaching people early. In fact, we located in Fishers, Indiana. One of the things that we wanted to do as part of giving back to the community was to actually do sport physical for younger kids,
Yes.
middle school kids, high school kids. You know, as a parent myself, like I would love for my kids to actually get the if you're gonna go to assuming that we have a car, we're gonna take the car to a mechanic. We want the best mechanic to actually look at it. We want to once we actually get the car back, there's no problem with the car. We trust that mechanic to actually say there's no problem with the car. If the mechanic takes 5 minutes with the car, doesn't really do a very good job. Of course, we're gonna find more problems later on, and we're gonna be very unhappy. We don't do that very much with our own health, like you were talking about. We get very small amount of information about our health, and we don't. I don't know why, but for some reason we don't. I'm gonna say it this way. It doesn't seem like we care a lot about what the future of our health is. We only worry about the current time, how things are going right now.
Mhm.
What I want to do is change the way kids thinks about their health. It's an investment. The more you invest on it, the more you're gonna get return on your investment. The least you invest on it, the least you're gonna get in return. So we do sport physical. I figure we can actually start with those kids, help educate them about their health, how to stay healthy. If you're gonna play sport, you really need to keep yourself hydrated. If you're gonna play sport, you need to make sure that if you are injured, you are healing properly. Because, for example, if you want to become a pro or you want to be successful later on in life, those injuries or those mismanagement are what's gonna keep you back. You know, so we work with parents. In the community. We go to the school. We offer sport physical that takes about an hour to actually really put those kids through rigorous process to make sure that they're actually good and that if there's something we can catch on early, we catch it early. And if they ever get hurt, we got plenty of opportunity here to actually help support them to heal faster and better, get their body stronger by the time they get back out and playing. And that doesn't stop just for those kids, it's for everyone. But obviously, we can't, we got to start somewhere. So I figure, hey, you know what? I used to play sport. That's a way to give back to the community. So we started this program only for a few high school and middle school. Um, yeah. So
Yeah.
and then we get to use the Mela Scan, which is again fantastic by telling our kids how their body's doing today, and we can track that going forward. So it's not blindly saying that you're healthy because we did a CBC and a BM before you and there was no abnormalities. We got much more data now.
Right, exactly. And like you're saying, the hydration and the recovery that that can influence, it's so huge. This just lights me up so much being, a retired public school teacher, just and being in health and PE and that whole arena. It's just so brilliant. You cover so many things by doing that one, offering that one service.
Right.
You are educating the children at a younger age, right? And they get it because they understand time and space in regards to their body, and then they know it all comes from within. And so being able to see where they are in real time, apply that to their sport, to their activity, is going to be huge. It also influences the community as a whole, because when we start at a younger age and we create this beautiful landscape for wellness at such a young age, that's going to influence the parents, it's going to influence the community like that, because
Right.
the kids will say, well, hold on, I need this, and then it might get the parents kind of scratching their head going, well, maybe I should consider that too.
Absolutely.
Right.
Absolutely. I
Yeah.
mean, my ideal clients are busy professional that really wants to kind of like they understand how important their health are, you know, but really I wouldn't be doing anyone any favor if I didn't start with the younger generation because those guys is good. People like me, like you, great, we understand what we need to do, but the younger people is where we're failing because
Mhm.
those are gonna become 30, 40 years old as well. But they won't know anything. So I could start at 12, I could start at 13, at 14, and all of a sudden they grow with that mindset that, hey, my health is the most important things in my life. I need to protect it. And that will change the way we practice medicine in this country because right now we have a, like I say, a reactive system driven by insurance company. And unfortunately, we don't have healthcare, we have insurance care,
Mhm.
which does not really put in nothing against insurance company, by the way. That's what they're supposed to do. Insurance is for when you get hurt and you're sick, and they're supposed to pay. That's their job. For car insurance, for home insurance, that's what they do. Except that we need to have healthcare where health is the most important, you know, and we need to understand as human being that we can't do anything without our health. We can't own nice houses. We can't drive our nice cars. We can't make money. We can't grow our kids. Like there's nothing you can do if you're not healthy. And therefore, we need to prioritize that as much as possible so we can stay healthy and enjoy everything else that we have that we get in life. For example, a nice house, a nice car, kids, husband and wife, and all those things, parents. We can enjoy those things because we're healthy. And that should be primary and not secondary.
Absolutely. Health is wealth.
I agree. I completely, I couldn't put it any better.
Yes. And so when these, when these students are going in for their Mela scan and they're going in for their physical that is coming to them in a new way. I mean, I went through physicals back when and it was take the blood pressure, do the,
Yeah.
the real quick scan, like, yep, check mark, she's good to
Yeah.
go. It was,
Right.
I had no idea what they were doing.
Right.
Nothing was explained to me.
No, no, nothing explained to you, nothing. It's like a factory. Just keep going. You get 10 minutes, next, next, next. No, no, we will sit down with you. We go over nutritions with you. We go over what to eat and drink. I mean, what to drink. Like, kids go, a lot of kids are drinking a lot of those energy drink now, because we, as the parents, we've been drinking that because we want to stay up and be able to do our work and everything else, and that get passed down to the kids, and they have a lot on their plates right now. And I understand that, but no one is educating those kids that those things are not actually very helpful for you, for your body. You
Mhm.
know, nothing against the industry, the energy industry or whatever else, but like my kids don't drink energy drink. The same way you wouldn't let your kids drink coffee at 10 is the same way they probably shouldn't be drinking those things. Um, um, and so we do education in that way. And then we even do hearing and vision tests because you'll be surprised how many times those kids, the parents assume they can see and can hear well. I think at school they probably do one hearing test for kids probably when they're elementary school and whatever else. What if something happens after that? No one knows. So in a yearly basis, we should at least get those things done. We go to dentist twice a year to brush our teeth, make sure there's no cavities and stuff like that. Our teeth are not the only thing that could go wrong in our system. Everything else could go wrong. Our hearing could go wrong. Our vision can go wrong. Smell can go wrong. All those things, I understand we'll probably say something about it, if it's going wrong, but a lot of time we don't know,
Mhm.
especially hearing and vision. We, if it's gradual, you don't know. And that could make the difference between whether you succeed or whether you're not succeeding on the field that you choose. Or it could make the difference between whether you stay healthy by catching something very early or not healthy because we didn't do anything about it for 5, 10 years.
Absolutely. And I do, that's exactly it, and when we see this collaboration not only between patient and doctor in such an informed way, like I love what you said, that you sit down with them and it's not a factory, it's you care, and there's there's compassion, and you want to understand, so you have that clinical context with your patients, because that is huge, just understanding where they're coming from. And it creates this relationship that has been so long lost because the industry has just turned the way it is. And again, there's nothing wrong. We need that allopathic care for the injuries that are, broken bones and TBIs and all of those kinds of situations. Yet when we're talking about just keeping and maintaining health as our foundation, when we have someone that knows us, that understands us, and that listens, it completely changes the game.
Right. And I would say we'd even go further with what you're saying by saying that having a good primary care doctor actually saves you so much trouble, because even let's assume that you're gonna have to go see a cardiologist because your heart is not doing well. Your biggest advocate is gonna be your primary care doctor. If your primary care doctor doesn't have time to call the cardiologist and say, hey, this is what I know about my patient and this is what I think should be done, you have you now on your own. I mean, I work in the hospital and I still practice traditional medicine, but you know how, at least in the hospital, I can go to my cardiologist and say, hey, this is what's going on. What are we doing for this patient? The outpatient physician don't have that luxury. They cannot. They have a note from the consultant that they read. The note does not reflect everything the consultant is thinking about. It just the notes are just for us to cover our back to say that this is what we were thinking for the moment, and that those are the things that we've done for you. So therefore, you know, for the most part, we are in compliance. But it does not replace. We continue talking about those cases far after we write that note, and there are new things that's come up. And unfortunately, at the time that we're seeing you again as a consultant, for example, we're not thinking about that. So we are in reactionary mode and we go right back to what we wrote before. So if you have a physician, a primary care doctor that could have call your cardiologist, for example, and say, hey, I realize the stress test is this, what's going on, and how are we going to treat that patient. Now we're talking about how we fix a problem, not how we react to it.
Mm-hmm.
And this is why in the hospital we can fix people a lot faster than an outpatient doctor can, because we have collaboration. We have so many people. But the problem with outpatient doctors is the time. They
Right.
don't have time. And the cardiologist doctor don't have the time to actually take your phone call either. If we can move to a system where at least your primary care doctor has the time, you know, then we making progress. And that's sort of like what I want to change in healthcare is
Beautiful.
give people more time, more access, and advocate for you as much as possible.
Yes, it's so beautiful. And being able to do that in a number of ways, right? Because you have the Mela scan and your patients see their results. They see their results in real time. They have them in their hands. So they actually are able to feel empowered to take their health back into their own hands, rather than just saying, okay, Dr. Milien, fix me of all the things. Well, let's work together with that, because now you have this foundation, you have this information. Here are suggestions within, I'm sure, of course, between IV therapy and red light and all of the incredible modalities that you offer there at Precision, they can then start utilizing that and watch and see how that's shifting in their own numbers.
Yeah, no, absolutely. And this is what we do exactly. One thing I will say about the Mela scan, I've been practicing for over 10 years. Whenever we do lab work for someone, or we do an echocardiogram or a CT scan, I very seldomly heard someone says, can I have my results?
Mm.
You'll go over the results with them. They'll be like, okay, thank you. But they never ask, can I have them to go home with?
Wow.
I have, I think 99% of my patients who have a Mela scan wants to, I don't offer it. They'll be like, would you be sending me those results? Like that's the first thing they ask, because that's a personal data to them. I don't know what's the difference between, why people don't say, can you send me my lab test? No, I typically don't hear that. Or no one ever asks me, can you send me my CAT scan of the brain? You know, no. But they will always ask me, can you send me my Mela scan result? It's so fascinating. It's the amount of data they get, and they can understand it. That's the thing.
Yes.
It's intuitive. It
Hmm.
makes sense to them.
Yes.
Whereas I guess a lab work, although it makes sense, we know that, but it's almost like we're so far away. Like it's intuitive, but not as intuitive as a Mela scan. And we've been using lab work for centuries. So,
Hmm.
I mean, just to kind of like show you how important the data we get from Mela scan and how easy it is to actually get people to do the right thing when it comes to wellness and overall their health.
Absolutely. And another thing to bring it back to the youth that you are working with now is you're promoting this new offering of different type of physicals for their athleticism and athletics. It's almost gamified. That's one thing about kids. They like numbers, right? Well, what's your score? What's your score? And
Right.
so they can almost kind of compete with each other.
Compete. Yeah.
Yeah.
Right. Right. Because the better your score is, the better you feel about yourself.
Yes.
And it creates that self-worth. And no longer that we can say, well, it's an abstract thing. We're not, no, you can see your number, it is what it is. And if you get a good number, you can compete with yourself, you can compete with your peers. You can say, hey, I'm doing well because my numbers are improving, you
Yeah.
know, and you want that with for kids. Actually, we do it as adults, even like husband and wives always come and they're like, you can see them competing. It's like, oh, your number is better than mine. So what am I doing wrong? And next thing you know, he's changing the way he eats. He's not drinking as much anymore. He's drinking more water because and women tend to actually be a little bit more self-conscious when it comes to their wellness, and us guys, we tend to be like, okay, well, we're feeling well, we out of, but whenever you do this, even for male, they're like, oh my God, yeah, no, I want to change A, B, C, D so I can get as good of a score as my wife, for example,
Right.
because the reason why she got that score is because she's doing all the right things.
That's right. Yep, it's exactly, my husband and I, we often like compare our step scores, right? So it's like, how many steps did you get today? Well, I better go for another little walk so that you don't beat me.
Right,
Yep,
exactly.
it's the same thing.
It's a fun way to continue to stay to improve your wellness and your health in general, and it makes you happy. There's
Oh,
no right. It makes you in general happy. So why not do it?
exactly. Yes, joy. That's the whole point of being here. Live in joy, be happy.
Right.
I just really love this conversation so much, Dr. Milien. I love everything that you're doing. You're brilliant and your work is just so profound. And I'm just in such deep gratitude to be able to be here and, have this conversation about the other options that are available to people to move from reactive care to proactive care. And sometimes people just don't know what's out there. And so to be able to highlight you and your work is just, it brings me so much joy. So thank you for doing what you do.
Well, thank you so much for having me. Well, it's a great opportunity to help educating people in general, and to be part of this community, to be part of Menla Tech community, where again, it's not very easy to find this technology. This is why it's not everywhere in every street. But we hope at some point it is because we want people to have access to that and we want people to know how the body is doing in general. So I couldn't be happier to be here and be part of this podcast and explain to people what we do. And for people surrounding Fishers, Indiana, the greater Indianapolis area, we have been proudly in um, serving them for about a year and a half, and we hope to actually be here for the next 20, 30 years. We want to make this um, part of this community. And we have a lot more people doing this now, which is good. I'm so happy that we're now looking at medicine in a way that actually makes sense to people, you know.
Yes.
So if any, for for people um, wondering how to actually get a hold of us or, where we are. Like I said, we're in downtown Fishers. You can look us up by going to precisionprimarycurewellness.com. We on every major social media with Precision PCW. It's Precision P as Peter, C cat, W as Walt. Um, you know, we're happy to help, and we here to make the community better.
Oh, beautiful. Yes. And I will absolutely include all of your contact links, your website, and your social media platforms in the description on this podcast. I highly recommend, if you're even outside of the Indianapolis area, head on over to Fishers, because getting yourself involved in a practice like Dr. Milien's, working with the Mela Scan and all of the different modalities that are offered there, it can radically change the trajectory, not only of your health, but of your life, as you heard here today. So thank you so much for sharing your time, your expertise, your wisdom, and your brilliance with us today.
Thank you so much, Rachel. So happy to do it.
What wonderful. Take care, everybody. We'll see you next time.